My name is Alexis Rogers, and I'm the Customer Relationship Lead here at RightCapital. And welcome to our Modeling and Presenting Medicare webinar. The goal of this webinar today is to just provide you with the resources needed to have impactful conversations with clients on Medicare. As clients get older, Medicare becomes increasingly relevant, but its intricacies can often be overwhelming and complex for clients, which is why it's even more important that you, as their advisor, have those easy to understand visuals to help a client truly understand what Medicare is, why it's important, and what it means for the client's physical and financial well-being, alongside some of the nuances associated with things like how it impacts Social Security filing, things along those lines. So today we're going to be highlighting how you can address this mystified topic within RightCapital in a way that's going to alleviate any apprehension surrounding the topic for a client. So today we're going to be highlighting, of course, the process for modeling Medicare and making sure that we're capturing the current path for a client. We're also going to be walking through our Medicare module and all the different facets of that particular module, including all the coverage options it can cover, and also how to illustrate those important Medicare factors and some of those key considerations and filing tips that can be beneficial for a client to have as a resource. We're also going to be highlighting the different resources that you as an advisor always have when leveraging RightCapital, of course. One of those resources being that during this webinar, if you have any questions, please feel free to use the questions drop down to type out your questions there. More than happy to answer any questions you might have. And so shifting gears into RightCapital, today we are going to be looking at the Swan and Turner family. And we're going to be starting in the profile blueprint just to touch on what their current path looks like, so that way we understand what the client case that we're working on is before we look at their Medicare picture and filing for Medicare and RightCapital. Under profile blueprints, starting in the net worth, here we can see that easy to understand visual of their current net worth of 2.2 million, including their primary home, and that they're in their early 60s. So Elizabeth is 61, Will is age 62. And under goals, we can see that they also have for their life goals a vacation coming up, and we have them retiring at 67 and 70 respectively for Will and Elizabeth. These are going to be key consideration factors when we're looking at the Medicare filing picture, of course, and some of those key considerations of whether we're still going to be working and when we're filing for Social Security and things along those lines. Under income, savings, and expenses, we can see what their current income looks like, their savings and expenses. In terms of their Social Security filing, Elizabeth is planning on filing at age 70, and Will is going to be filing at full retirement age at age 67 for himself. So this is, of course, going to play a role when we're looking at Medicare options, but it's going to be one of those key considerations for, are we already potentially filing for Medicare Part A, B, or D as applicable. A really important aspect of ensuring that we're capturing the current path for Medicare is going to be established under profile goals. This can also be modified under the blueprint goals, but we're going to be focusing on the profile goals for now. And this is going to be the data entry for Medicare. So under profile goals, we're going to click into the annual retirement healthcare cost card. And this is going to be where we would indicate in the system to turn on Medicare premium calculations. Within the retirement healthcare cost card, you have full control over when we want to assume that this cost starts and also what the cost itself is. If we're looking to capture Medicare premiums, that is when we would want to change our cost estimate from either national average or customized amount and select the detailed estimate. With the detailed estimate option, this is when we're going to see 4 fields populate where we can start to enter the parameters for the client's Medicare picture. One of the most important things, of course, though, is when we're indicating this cost starts. So one of the reasons why we can choose when this cost starts is sometimes this might be a delayed filing for Medicare or the retirement healthcare cost itself, depending upon when the client is leaving maybe potentially group coverage from the employer that they're working with. Maybe they're looking to file for Medicare prior to retiring, depending upon their circumstances, their age, and the factors of what their employer is covering. And they're all oftentimes that case of they're just going to be looking at the retirement healthcare costs starting at their retirement. In this case, that's going to be the situation for this particular client case. So we're going to leave the cost starts at their retirement age, but you can fully control when we want to assume that the cost starts. When we select detailed estimate, those 4 fields that are going to be relevant are going to be the pre-Medicare costs field and a couple other choices. But starting with the pre-Medicare cost field, this particular field is only going to be relevant if we have this cost starting prior to the client's age 65. So for the example of we have them starting this cost at age 60, we'd be using whatever cost we indicate in the pre-Medicare cost field as their healthcare cost, growing with healthcare cost inflation, of course, each year until age 65. Once the client turned age 65, that is when we'd see Medicare premiums Part B and D be calculated automatically based off of AGI. An important thing to note as we're navigating throughout the conversations of Medicare is the system is considering the 2-year look back that's applicable when calculating Medicare premiums. But once the client turns age 65, Medicare Part B and D can be calculated off of AGI automatically. An important aspect here, though, is for Medicare Part D. There are circumstances in which an individual might not be enrolling in Medicare Part D. For example, if they were working for the military or having a certain kind of exception to what they're going to be having for coverage, they may not be filing for Medicare Part D. So if that's the case, we do have the option from this drop down to indicate that they're actually not enrolled in Medicare Part D. And that would be turning off the Medicare Part D calculations for this client. We also have a field to indicate any out-of-pocket costs. This is going to be a cost that's displayed on top of the Medicare premiums that we're indicating. This is typically things like that extra coverage if we're trying to get additional dental or vision coverage that we can capture in this particular field. So if we know, for example, that their extra out-of-pocket cost, once they turn age 65, of course, is going to be $2,000 a year, inflated with healthcare inflation, of course, we can indicate that from here. And once we're ready, we can hit the save button. Another important factor for if we have somebody that might be already filing for Medicare or is going to be close to filing, and especially because I noted we are considering that 2-year look back when it comes to things like Medicare premium calculations and the MAGI that's considered there. One thing to note for somebody that's already filing and is at that age, we'd want to make sure we're navigating to the gear icon settings page. And here under tax assumptions, there's going to be a space at the very bottom of this page for you to be able to specify the prior year's MAGI. If we have this information, and especially if they are filing for Medicare already or close to filing either this year or next year in terms of the projections, this can be a beneficial space for you to enter the MAGI, so that way the calculation for Medicare premiums is just a little bit more accurate. The system, if not, we don't have this information, and if we have them filing for Medicare or indicating Medicare expenses have already started, the system will do its best to calculate what the past MAGIs would look like. But if we have this information, that's a fantastic opportunity to specify that from here. This also can be relevant for student loan calculations if that's applicable as well, but particularly for the Medicare conversation, for somebody that's already filing in the system, we can indicate that information from here. That's not the case for the Swans and Turners though, so we're going to leave that as is. Now that we walk through some of those key considerations or just inputting and capturing Medicare for the current path, we're going to be looking at some of the tips and tricks and some of those factors to consider for filing and demystifying the conversation with the client, which is going to be found under the retirement module and within our Medicare module itself. This Medicare module is intended to be an educational resource that is particularly client facing. This is a standalone module and it's going to have a lot of very beneficial resources for the client to utilize, but can also be that space to look at some of those key filing considerations in terms of, are we frequent travelers? Do we oftentimes go to the doctor, or are we more, staying at home? Things along those lines. So starting in the Medicare module, under the first tab, we're going to see some key Medicare considerations. But before we start to look at that, under the action items is where we're going to see a lot of those beneficial resources, starting with the proposed Medicare choices. So what we select here from this proposed Medicare choices dropdown is going to be determining the visuals we're going to see here in terms of what's covering our needs. So right now we have original Medicare Part A, B, and D selected, but we can look at original Medicare Part A, B, D, and Medigap coverage. And we can also look at Medicare Advantage with prescription drugs as an option as well. But for now, we're going to be focusing on the first option for original Medicare Part A, B, and D. So with that selected, under the Medicare tab specifically, this is where we'd indicate some of those key considerations and can be that testing space, especially for a client, to get more familiar with some of the things that we want to make sure we have in line, so that way we understand the need for Medicare and what Medicare option might be best suited for the client's needs. That first option being, of course, some of the location considerations. So if we are frequently traveling and we visit doctors at various spaces, as we know, a lot of times in retirement, you're saving up for a lot of vacation goals, for traveling oftentimes. So you might be seeing doctors abroad or in just different locations across the US. If that's the case, that's when you'd of course select that they're a traveler or snowbird and they need to see a doctor at multiple locations. If they're not, and they're oftentimes more going to be visiting the same doctor in their home network, we can select that from this drop down. But depending upon what we select here, we're going to see if the proposed option that we selected is going to allow for that flexibility on doctor choices, or if it's going to be better suited for that need for the in-network doctors. Same thing for health considerations. Looking at the idea of, are we typically healthy and we're working with deductible copay coinsurance for the lower premiums themselves and saving some money that way? Or do we know that we're going to be having a little bit of a health risk and we see the doctor frequently and are knowing that we're probably in retirement ages especially going to be visiting them frequently and want to avoid any copay or deductibles piling up? If that's the case, we can select that option, and we'll see that if that's the case with proposed option original Medicare Part A, B, and D, that the deductible and copay is going to be piling up if we do see the doctor frequently. And we also have that risk consideration. So if they prefer more predictable costs with an out-of-pocket limit, or if they're okay with less predictable costs with an out-of-pocket limit, we can see these key considerations and play around with which potential option makes the most sense depending upon what we're selecting. So as we select the different proposed Medicare choices, we'll see which ones are going to be checking off that box essentially for that consideration and which ones don't necessarily do that. And under coverage, this is going to be a similar idea, but this is going to be defining the actual program that you're applying for within Medicare. So that idea that what's covered in Medicare Part A, B, D versus what's not covered. So in particular, one of the key things that you're going to note when we are looking at Medicare in general is that long-term care in particular is typically not going to be covered by Medicare policies. So here we're going to typically see long-term care is not covered. That's just there for that informational resource of the idea if we're looking at a long-term care event, potentially looking at a different funding source for long-term care, such as long-term care insurance. But as we select different options from this list, we're going to see what is covered in the Medicare page, but coverage is going to be a great space to check in. For hospital insurance, that would be covered in Medicare Part A, of course, because that is the hospital coverage. With Medicare Part B, it's that informational source that is going to be looking at medical insurance for medical expenses. and Part D is focusing, of course, on the prescription drugs program. We're also going to see that dental, vision, and hearing with what we have selected is not covered. That's typically when we look at things like different programs, such as Medicare Advantage with prescription drugs. So we can see what's checked off. Like I said, for all the options, long-term care is not typically covered unless it's an extenuating circumstance. So we're not going to see that that's covered for any of the options for proposals. Once we have that information covered, under the enrollment tab, this is where we're going to see another thing for clients specifically to consider about the enrollment process. That's going to be things like, when are we filing for Social Security? Are we going to be filing prior to Medicare filing age of 65? Or are we not going to be filing, which for Elizabeth Swan is not the case. So we're going to deselect that option. And also, what is happening with the employer coverage? Do we have a group plan? From this dropdown, we can indicate if we have group coverage, if it's for a plan that covers more than 20 employees, less than 20 employees, or if they have a retiree health plan or COBRA, or if they don't have group plan coverage, as this can be one of those key things to consider about, can you file for certain aspects, or should you talk to your employer before filing for Medicare in particular. So as you make those kinds of changes, that's when the second part of the action items here in the enrollment period, this information will adjust with what we're modifying for this selection. So for example, with what we have selected, we'll see that for Elizabeth, that she should be talking with the group benefit administrator to ask about signing up for Medicare 3 months prior to the 65th birthday, of course, and the potential for delaying Medicare enrollment to continue to use the group plan coverage if it qualifies, which is why it's important, of course, to touch base with the employer's benefit administrator to see if that is a qualifying program to delay filing Medicare. Because if it's not, that's of course the instance where we would need to file for Medicare to avoid any penalties for certain Medicare programs. So it's just some tips and tricks in the action items about the enrollment period. We can see that with Will in particular, he would need to enroll in all 3 if that's the desired program that we want to choose prior to his 65th birthday in July 2026. So it's going to be very interactive in terms of getting that information and just some tips and tricks for filing. And that brings us to the final tab here, which is the tips for filing. So a key thing that is often a source of confusion for clients is if Medicare enrollment's automatic for certain programs. It's not, so it's going to be listed here. And if they have certain benefits from the employer, if they've got retiree healthcare plans or benefits or COBRA, the confusion about if they still need Medicare, and also the kind of consequences of missing the enrollment period. That is, of course, can be a lifetime impact in terms of an increase on premiums. So that's that key point to cover here. And also a point of oftentimes a lot of questions surround the HSAs and if you're still able to contribute to an HSA. When filing for Medicare, that's not possible. So this is going to be something that's listed here. Same thing if you're enrolled in Medicare Advantage, if you still need a Medigap policy. And also that idea of what's the total cost or just the average, it'll be listed here for a resource as well. This is just some information that can be beneficial to connecting those dots to the client that you can easily highlight directly here and have that interactive conversation about the true needs and also the impacts of Medicare filing as well. At the very bottom of the action items, there is going to be 2 sources listed. The first one is going to be the Social Security Administration website that you can click on to bring you directly to the Social Security Administration website. Right there, you're going to have an easily accessible link in terms of getting benefits estimates. This will also list out some Medicare impacts directly there as well for a resource. Same thing, of course, with the actual Medicare website that you can click onto and start to discuss further some of those resources that a client can have, but they can be actually pretty interactive and some easy ways to navigate through those 2 sources from the government. But once we cover that information, those key considerations that can be beneficial to just shining some light about the Medicare picture itself, that's when we can also look at the actual numbers. What is the Medicare cost for the client? Especially when we turned on the calculations for Medicare premiums. we want to see where that information is or what that looks like. That's a great opportunity to navigate to our retirement cash flows. And here we can view our summary page in particular, and we can drill down into our expenses column to see what's making up the expenses by clicking on the header. And then we are going to click further into healthcare, and we want to click into wills in particular, and we can see that actual numeric cost each year for Medicare Part B and D and the other costs that we indicated as well. And we can see how that's going to be changing each year, fluctuating as they start to have some shifts in terms of magi later on in life as well. So this is where we can see that number-wise how much it's costing in terms of future projections across their lifetime as a resource. We can see that year-by-year breakdown here under summary of the cash inflows and cash outflows, just to get a gauge as to what's happening each year, what's happening in terms of income, and some of those key factors that are going to be contributing to impacting our magi as well. A key thing that can assist in the visual, though, of understanding the impacts of different premium brackets is going to be found under our tax module. So under tax distributions, this is oftentimes utilized for our Roth conversion tool. It's a Roth conversion fill up the brackets tool, but it has a couple other functionalities as well. And one of those, and a key part of Roth conversions typically, is the question of how is that going to impact Medicare premiums. But under the distributions tool, we're going to be greeted with our ordinary income tax bracket chart, which is where we can see what the adjusted taxable income looks like each year over time. But if we click on the drop down here, we also can view the Medicare premium tax brackets over time. And this is where we can visualize where, especially obviously past age 65, and some of those key considerations, what our magi is, and also the brackets for premium increases. We can see that those higher ones, if we are potentially doing things like Roth conversions or just having adjustments to our magi from maybe some bigger life events, we can see how that's going to be bumping us forward into some of the higher brackets. So we can see, similar to what we were seeing in the actual cash flows, that we're bumping up to higher premium brackets later on in life. And we can gauge that information from here. We can also see listed the actual thresholds for the premium brackets as well for reference. Another key thing too, just talking on Roth conversions, within the Roth conversion tool, if we are looking to analyze Roth conversions as a particular path and we're trying to gauge if a certain route might be incurring additional income related monthly adjustment amounts or IRMA to Medicare, there is the option for the Roth conversion tool to, instead of looking specifically at ordinary income tax brackets, to look at the Medicare premium tax brackets. And we can use this slider to indicate that we don't want to trigger IRMA. And this will be that kind of still the intelligent Roth conversion tool, but it's going to be focusing on the Medicare picture. So if that's also a concern, but we still want to do things like Roth conversions, that is available in this particular tool as well. But for this one, we're going to leave it as is. And under details, if we click on the drop down here and look at the Medicare premium chart, this is going to be similar to what we saw back in the actual cash flows, but this is just another space to see that same information, but especially if we did indicate Roth conversions in this tool, we can still see how that's going to impact their magi over time. It's going to be easily listed here. We can also see that Medicare premium threshold and also the Medicare premium costs themselves for each year. So this is just another way to really be focusing on the actual Medicare premium information that's easily accessible in this tab alongside that chart for Medicare premiums as well. Another key thing that I want to note when we are navigating throughout each of the different modules of RightCapital, and especially as the idea of potentially using this for client conversation pieces, but things like the retirement Medicare module itself. So we go back to retirement Medicare. We do have the ability to add notes throughout each of the modules. So throughout each of the ones we covered, from the actual retirement healthcare cost entry to the distribution module to this module, we can add notes on each of these sections. So if we click on the notes button right here, this will allow for us to either leave a note that's client facing and marked as shared with client, or that's an internal record and is marked as not shared with client. This can be beneficial, especially if you're trying to have that open line of communication with the client, or if you're trying to provide a resource to the client, a note or an intention behind this particular module or what we're discussing on this module. This can be a great way to kind of have that personal touch with the client directly here. And this can be viewed whether we're doing that live presentation and looking at the module if it's marked as shared with client, of course. If the client's engaged directly in RightCapital, they can see that note that's marked as shared with client. And if we download a PDF report as well, we would see that listed there for reference. So it's just another way to have that kind of open line of communication with the client to engage them in the system and make it feel like that more white glove approach if you're trying to shine some extra light on what the module is intending to do and the actual client picture as well. Which is going to bring us to some of our next points, which is the aspect of including this in conversations with clients or presentations with clients. So if we go to the gear icon in the upper right-hand corner and under report, this is going to be, of course, where we curate those PDF reports, but especially if we're trying to really focus on the Medicare picture and we're trying to cover exactly the modules that we wanted to, this is where we can go to refine what's included in that PDF report and make that focus on the Medicare picture. So we can click on the Medicare header. Same thing with the cash flows. If we wanted to isolate that specific cost, we can. Cash flows is going to be one of the things that are underlined though. So as we kind of saw with the actual cash flows, anytime we see something underlined in RightCapital, it's a key indicator we can click into it to see additional information. So for this picture, we're trying to purely focus on the summary. So we're going to select just those. And especially if maybe you had multiple proposals, maybe we're trying to analyze Roth conversions versus no Roth conversions, might be when we're including multiple cash flows. That's when you can use the toggle feature right here to select which plans we want to include for the cash flows. And we can include that tax distribution visual as well. So we can check that off right here. And anything that we had indicated as a note that's marked as shared with client in these modules will be included in the visual itself. And so that's also maybe when we're including blueprint as well. One thing that I want to note is the flow of the report is also entirely customizable. So we can actually drag and drop each of these modules to reorder the flow of the PDF report. So if we wanted to talk about blueprint first, talk about the current path, the current filing picture, we can just drag that forward. And maybe we want to talk about the cash flows first, we can just reorder as desired. And once we hit download selected pages, that'll download a PDF report for us with that exact flow selected. Another key thing in terms of presenting in RightCapital is going to be found under our advisor portal. So we go back to the advisor portal and we search for the client once more. Under planning access, if we click on the downward arrow right here, this will allow for us to open this client in the client access mode, which is also oftentimes referred to as our client presentation mode as well. So if we were trying to cover and isolate just the Medicare picture, we wanted to highlight just specifically the modules we covered in today's conversation. That would be when we can check off the cash flows, for example, and maybe this is an instance where we also click into the header right here to be further refined in what's included. Checking off the Medicare option, checking off distributions, and we're only going to be checking off blueprint. Once we hit save, we can then click on the downward arrow and open in client access mode to see that really focused conversation on the Medicare picture. So this allows for us to still have the interactive experience to click through each of the modules, talk about the Medicare considerations, and use this module for that interactive conversation. Same thing with the cash flows. We can still see that information, really focusing on the exact picture we want to cover here. Same thing on the tax distribution. So it's going to be very focused and very honed in terms of the client engagement aspect. Same thing if we were engaging a client directly in RightCapital, this is also what they would see as well. Another great aspect of this particular presentation mode, though, is that this is also intended to be an uninterrupted presentation mode. So for example, if you were messaging our fantastic support team using that chat feature, and maybe they responded to your question, we would not see that response when we're in this presentation mode. As I said, this is supposed to be uninterrupted, so we would not be interrupted by that little chat bubble if we were in the presentation. But those are just two different tips and tricks for different ways to present in RightCapital that can be added to your toolbox. But there is another important aspect of having that white glove approach as an advisor, and especially as your book of business continues to grow. One of the key aspects that are available in RightCapital can be found within our RightIntel module. This is, of course, our book of business intelligent tool. But one of the key things here is actually going to be found under the opportunities and under key events. This is going to be where we can see those key events that are coming up, one of those being Medicare filing. So especially if you have a long list of clients, it can be difficult kind of tracking who is close to Medicare filing age. This key events section would be a great space to see who is close to that Medicare filing age. And you can also receive notifications of this information as well, which I'll review in a second how you can change your notification preferences. But under key events, we can see here, just using this toggle feature, focusing on what's coming up for key events this year, next year, as we want to start to prepare, this month, or all time if we wanted to. Or we're going to be focusing on what's happening this year. And we can use the all key events dropdown to focus specifically on Medicare filing to see who might be coming up in the next couple of years for Medicare filing. So for this conversation, next year is when I have a lot of clients that are going to be filing for Medicare, especially towards the beginning of the year. So we can start to actually prep now if we wanted to on the conversations and making sure the client feels comfortable with the Medicare process, give them those insights. We can also change the filter by client group if desired as well. So it's a great space to see that information in terms of who is going to be filing soon for Medicare or preparing for the future in next year's conversation or in the next couple months, to make sure that you have that really personal approach. You can have that engagement with the client, make sure they're prepped for that Medicare filing process. A key thing if you were trying to ensure that you're getting notifications about who's coming up for those opportunities is going to be found under your bell icon and in your notification center. So under notification settings, and I already see this as a question, so this is where you go to control your notification settings. And there's going to be 3 different kinds of ways you can have notifications. For the opportunities and for the RightIntel key events, there's going to be 2 options here, which is going to be it being included in the notification center, which is that first page we just saw, or in a daily report email. So if we wanted an email to be sent out with those key events that are coming up, as we saw in RightIntel, there's a couple other ones besides Medicare filing, things like people who are close to the age 59 and a half, penalty-free age, retirement, and some of those other key events. We can just check off this box. And going forward, that notification will be included in the daily report email. And so another key aspect too is if we are wanting to ensure the client feels comfortable, and if we do have the client engaged directly in RightCapital, there is another way we can engage the client back and forth between each other, you as an advisor and the client. So if we just open up the Swan family once again, this can actually be done in the dashboard tasks section, which is where we can go to assign tasks to the client or assign tasks to yourself as an advisor. So especially if you have a specific workflow or a specific process for prepping a client for Medicare filing, maybe you want to have them book some time with you, that can be a key opportunity to use tasks for that client engagement aspect. So in this instance, maybe we're going to be assigning a single task. We want to instruct the client to book some time with us. We can do that with this particular tasks module. From here, we can assign that due date. We can also set a frequency. So if maybe this wasn't booking time, or maybe we do want them to book time with us quarterly, monthly, semi-annually, or an annual check-in, we can make this a recurring task. And from there, we can also assign this, whether it's to ourselves or the clients. We can also mark this as high priority if we wanted to. And in this case, we do want to mark it as visible to client. But if this was an internal workflow, and maybe it's for yourself as the advisor to maybe check some of those key considerations, ensure that you have maybe what their current healthcare coverage is in the system, anything like that, you can mark this as not shared with the client by clicking on the eye icon. In this case, we do want this to be shared with the client, and then we would just assign our task right here. We can include that link as we want to. Hit save. And we're now going to see that populate as a task. And this is, of course, really relevant if we do have them invited directly in the system, of course. If we do, they would then, if we've granted them access to the tasks module, they would then be able to see and then leverage this particular task. So it's a great way to have that client engagement, provide those insights, and there is that option for potentially the client to assign a task back to you. So if they've got questions or if they want to assign you a task, they certainly can if you've got that checked off in your own permissions under the 3 dots client settings section in your advisor profile. So it's a great way to either have that one-off of the single task, and if you do have task templates curated, one that's particular for the Medicare filing process, you can also apply that directly here as well. But there's a lot of different ways that you can engage the client in the system, whether you're leaving notes throughout the modules with your intention for something, maybe to paint the picture, provide that personal touch to each data entry point for the client, or if you are engaging them with tasks, or when presenting using those couple different methods that we highlighted today to present that information.